My name is Precious Domsel. I'm a midwife. I've worked in so many contexts in the maternity, and then the most recent project that I worked is Zalinji project, which is in Darfur, South Sudan Mission, Okba. So today I will be talking about adapting in terms of crisis to dictate maternal malnutrition. Maternal malnutrition, what it means. It refers to the dietary intake and then the nutritional status of a woman before pregnancy, during pregnancy, and during lactation. And then we say that this lack of adequate nutrients can affect the mother, as we will see here. These are the effects of malnutrition during pregnancy. To the mother, we have anemia, which is the most commonest. We have preterm labor, increased risk of mortality to the mother, and also postpartum depression, impaired lactation. For the newborn, one of the effects is low birth weight, intrauterine growth retardation, congenital abnormalities linked to micronutrient deficiencies. So we said MWAC screening, it's very simple, it's cost effective. And if it helps you to dictate that the mother is malnourished, and nutritional supplement improve the maternal, fetal, and newborn outcome. In our next slide, we will see briefly a video of Zalinji project. Zalinji project is an emergency project in Darfur, Sudan. MSF started its intervention in April 2024. Following the crisis. In total, we have 180 beds in the hospital. And the services provided, we have a triage, we have ER, emergency room, we have the ITFC, Paediatric, the PICO, we have the operational theater, the OT, we also have the neonatology, which we have the NICO, and then the maternity. So from this video here, you will see the picture of the hospital, the maternity, and then also the neonatology. The maternity. So the maternity, we do the CMOC activities, and we have in total 28 beds. An average of 300 deliveries in a month is being conducted. And then an average also of 800 admissions in the maternity, which includes the obstetric and gynae room, the delivery room as well. OPD activities, it's been done by IMC. IMC left in December 2024, and then they handed over to MOH. The departure of IMC resulted in poor ANC coverage, and we started noticing high increase maternal moderate acute malnutrition without complications. We will see in our graph in the next slide. So this is our graph showing us the moderate acute malnutrition, non-complicated, and this is only the result of gynae and obs ward. And like I said, we have in total of 800 admissions, and these are some of the cases that are moderate acute malnutrition. So in addressing this gap, MSF intervention to address malnutrition to these pregnant, lactating women and girls. So one of the things we initiated in Zalinji Teaching Hospital is a routine MWAC screening for all women at the time of admission. So this is not done only in the maternity, but then also in the neonatology, because we have mothers that their neonates are admitted in the neonatology. And then also we do this routine systematic screening. Supplementary food, BP5, that is given to these malnourished women. And then we check the MWAC. Once it's less than 230, we give this BP5 according to the protocol. Mobile clinic started. So we started this mobile clinic following a small assessment. And in the mobile clinic, we do OPD activities. That's ANC, PNC, and then we give this nutritional support to mothers that are malnourished. Advocacy for other organizations to take over and sustain these community-based activities. How was this intervention achieved? So how we achieved this was capacity building, training the nurses and the midwives in both the maternity and the neonatology so that they know all the techniques in measuring the mark and then as well as giving the supplement. Also, a focal point was identified in all the departments, the neonatology and the maternity, and they follow up to ensure that every woman admitted in the neonatology and maternity are being screened. Protocol, which is very important, just to remind the staffs that this is how you need to provide these supplements. Then pharmacy, we collaborated with the pharmacy to ensure that we don't have any rupture. It should be available at any time, the BP5 that we give. Community engagement. This is very important because always we talk about prevention is better than cure. So they were trained community health workers. We trained 55 community health workers to create this awareness in the community, and then also the women need to report to the maternity on time. Results were also recorded in patient file and registered to ensure consistency of data. Challenges. So in every intervention, we usually have some challenges. So one of our challenges here is the absence of OPD services. So MSF in Zalingi, we do not have these OPD activities. So when we admit these patients in the maternity or neonatology and we give them this supplementary feed, the BP5, upon discharge, they do not continue follow-up because we do not have this capacity. Then also, this withdrawal of other actors. Presently, now in the maternity, we have other actors that are supporting PHCCs, but unfortunately, they are not supporting nutritional support for now. Mobile clinic. This was initiated, but we only go once in a while, or maybe sometimes once in 2 weeks, because of the security issues, and then as well as the distance from Zalingi to the place of the mobile clinic. Our successes, one of it is early identification of malnutrition, and secondly, it has enhanced community awareness on maternal care. I will talk quickly on operational recommendations. So I divided this into 3. We have the frontline staffs, the managers, and then the technical support. For the frontline staffs, this is very important because they are the first contact of the patient. So one of the recommendations is to ensure regular refresher training for all the staffs. Increase community awareness to continue this training, which was done initially, but we need to continue training the community health workers. Regular cluster meetings. So these meetings usually is with other actors that are present in Zalingi Teaching Hospital to know some of the activities that they are doing and also to know their challenges, and as well as have a clear referral link with other actors that can provide nutritional support. So recommendations to managers and coordinations. One of it is to ensure maternal nutrition is discussed as part of our nutritional health improvement strategy. Also to advocate with other actors, because we as MSF, we try to focus in the hospital, attending to emergencies, and then in the community, it's lacking. Include ANC as key intervention, ensure nutritional supplements are always available. And then for our technical support, the recommendation is to ensure regular visits to the project and then also see some gaps and then make some recommendations, as well as review and update manuals and protocols. Thank you so much for listening. Yeah.